Are you aware that the recent WHO reports indicate diabetes mellitus as the sixth leading cause of death? Diabetes mellitus is a metabolic disease, mainly referred to as hyperglycemia, a condition in which the blood sugar level jumps from a normal fasting range of 70 to 100 milligrams per deciliter. It mainly happens when insulin production by the pancreas is abnormal. Worldwide, 4 distinct forms of the disease have been identified: gestational diabetes, prediabetes, type 1 diabetes, and type 2 diabetes mellitus, the latter of which is by far the most prevalent and severe. A research by the World Health Organization found that diabetes is directly responsible for over 1.5 million deaths worldwide each year. The current 2023 prevalence report indicates that 96% of cases of type 2 diabetes result from insulin resistance. This raises the question, how can one know if they have insulin resistance? Patients with type 2 diabetes often report symptoms such as increased thirst, urination, and tiredness. Acute and long-term consequences associated with high blood sugar levels can lead to cardiovascular disorders. All forms of diabetes, their links to other chronic conditions, the value of early diagnosis and treatment, and preventative measures are discussed in this video. Critical role of insulin, the pancreatic secretion, in diabetes. Diabetes is defined as a state of increased glucose levels in the bloodstream. The increase in glucose levels is directly linked to the production of insulin by the pancreatic beta cells. When a meal is consumed and digested in the stomach, carbohydrates are broken down into glucose in the bloodstream. The pancreas closely monitors all this process and releases insulin in response, which moves blood glucose to different cells of the body to perform the body's other functions regularly in the form of energy. When pancreatic beta cells are dysfunctional, they fail to secrete insulin in response to the body's demands, leading to insulin resistance, which results in an increase in blood glucose levels, a condition referred to as diabetes mellitus. Early-stage diabetic patients consider it a slight case, but they should be well aware that this could lead them to chronic diseases such as kidney failure, heart attack, and stroke, a reason why diabetes is usually called the mother of other diseases. A recent report considered diabetes as one of the top 10 death-related diseases. Furthermore, type 2 diabetes accounts for nearly 96% of the patient's risk factors. Types of diabetes. Diabetes can manifest itself in a variety of forms, the most prevalent of which are gestational diabetes, prediabetes, type 1 diabetes, and type 2 diabetes, a condition in which a patient's glucose level does not remain normal and does not increase enough to be labeled as diabetes is known as prediabetes. In this case, patients usually fast at sugar levels of 100 to 125 milligrams per deciliter. This will increase the risk of diabetes in the future. Diabetes type 1 is often referred to as juvenile onset diabetes or insulin-dependent diabetes. It is an autoimmune disease in which the body's immune system targets beta cells in the pancreas and destroys them up to 90%, resulting in little or no insulin production. Due to insulin deficiency, the glucose level in the blood increases, which is known as type 1 diabetes. Fewer than 30 people are affected by this type of diabetes. Type 2 diabetes is known to be insulin-independent or adult onset. In this condition, the patient's pancreas produces more insulin than usual, and the body becomes resistant to its effects. There is insufficient insulin in the body to meet its needs, which causes type 2 diabetes by increasing blood sugar levels. This type of diabetes mainly occurs in individuals over 30 years of age. Gestational diabetes usually develops during pregnancy. This could have occurred in the patients with a family history of diabetes. Casually, the patient feels no symptoms of diabetes. That's why the healthcare provider tests the pregnant lady's sugar during 24 to 28 weeks. Maturity onset diabetes of the young MOD. Y is a condition that occurs when a single gene mutation in a family transfers to young individuals below the age of 30. Regardless of the form of diabetes a patient has, the most important thing is that their blood glucose levels increase. Causes of diabetes mellitus. As discussed earlier, Insulin resistance leads to type 2 diabetes, in which fats, muscles, and liver fail to respond to insulin as expected. Obesity, insufficient physical activity, medications, and improper diet are some factors that affect insulin resistance. Hyperglycemia results from insulin insufficiency, which occurs in people with type 1 diabetes because the immune system mistakenly targets insulin-producing cells. During pregnancy, the placenta secretes some hormones that can cause insulin resistance and the development of gestational diabetes. Some genetic mutations can also result in diabetes, such as mutations in the GCK-HENF4AA, HNF1AA, and HNF1B genes, which are responsible for maturity-onset diabetes in young individuals. Symptoms of diabetes mellitus. In the early stages of the disease, patients have no symptoms of diabetes. Later, diabetic patients belonging to any category may have these symptoms, such as an increase in thirst, hunger, and urination, during which excess glucose in the blood is broken down into urine, which is technically known as polyuria. This excessive urination leads to an increase in thirst, which is called polydipsia, because all excess calories are lost when urinating. A diabetic patient may have lost weight. To compensate for this weight loss, people feel hungry. Individuals with diabetes may also experience symptoms such as nausea, blurred vision, and sleepiness. Complications of diabetes lead to cardiovascular diseases. When a person has high blood glucose levels for an extended period of time, their blood arteries grow constricted, resulting in a decrease in blood flow throughout the body. This low level of blood flow leads to problems such as atherosclerosis, stroke, or heart attack. It is well established that diabetic patients have a risk of atherosclerosis 2 to 4 times higher than that of healthy individuals. Damage to other organs can result from constricted blood arteries, such as the heart, brain, legs, eyes, kidneys, skin, and nerves. Diagnosis. We can diagnose diabetes by 2 primary tests. The first test is a fasting blood glucose test, in which the blood glucose level of patients is examined on an empty stomach, usually in the early morning. The results for a normal level should be less than 100 milligrams per deciliter. For prediabetes, it should be between 100 and 125 milligrams per deciliter. Above this range, diabetes is considered. In the second test, the blood samples of patients are taken randomly and examined for blood sugar levels. The glycated hemoglobin, or a 1C test, measures how much glucose has been accumulated in the blood over the course of 2 to 3 months. Treatment. It is possible to manage type 1 diabetes by using insulin tablets or injections. Insulin pumps are also utilized. Sometimes, pancreas transplantation is considered the final solution for patients with type 1 diabetes. Certain oral medicines can be used in conjunction with lifestyle changes and regular blood sugar testing to help people with type 2 diabetes maintain their normal blood sugar levels. To live a diabetic-free life, or even free of any disease, the first and foremost thing is to treat oneself with a healthy weight and diet. Preventions. Although there is no prevention for type 1 diabetes, similar to other diabetes types, it could be prevented by adopting lifestyle changes, such as eating healthy food that is lower in fats and calories, but higher in fiber, such as fruits and vegetables. Try to get at least 30 minutes of aerobic exercise every day or 150 minutes each week. Aerobic activity is a type of physical exercise that increases heart rate and the amount of oxygen inhaled for energy production. If you are obese, you should lose weight by at least 7%, but remember that you do not lose weight during pregnancy. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.